Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody. Thanks for tuning in for Direct Connection. We begin tonight with the proposed replacement for the Affordable Care Act. Debate in Washington is shifting to the Senate now that the House has approved the American Health Care Act. One of those voting yes was Maryland 1st District Congressman Andy Harris, who joins us now from Baltimore County. Dr. Harris, thank you for being with us. From your perspective, what are the most important parts of this bill?
Well, the most important part is that it's going to bring down premiums, and that couldn't come at a better time now that Care First has requested a 58.8% increase in their most popular Obamacare plan in Maryland. Obamacare plans are just simply unaffordable, so we're going to bring those premiums down while we maintain coverage for people with diseases. We keep people on their parents' plan till age 26. We don't charge, no difference in charge between men and women. I mean, guaranteed issue of policies. In Maryland, this is going to be a win-win-win.
Congress is in recess today, so you spent your day keeping up on your medical license, practicing at a local hospital. I'm curious if you heard anything about this from either patients or your colleagues today.
We've spent the last week going around the district. We've been talking to people both before and after the vote on Friday. People in my district are worried about the cost of medical insurance. They need help, and we sent them help. We think I think that getting more of the health care insurance decisions back into the state is the right thing to do. We were in pretty good shape before the Affordable Care Act. Individual policies actually were much more affordable, and I think they're going to get that way if the Senate agrees to what the House has reformed.
Senator Sanders was quoted as saying that this is going to cost millions of people their coverage and it's going to kill thousands, he said. How can there be such disagreement about what this is going to do?
Well, look, we've heard the sky is falling all the time. Look, Mr. Sanders wants a single-payer system. He wants VA health care for everyone. That's just not going to work. It's not going to work in America. It's not a good way to deliver health care. I just basically disagree with Mr. Sanders. I think more people are going to be taken care of under our plan, and their health care is going to be better. If they like their doctor, they're going to be able to keep them. The insurance premiums are going to go down. More people are going to be able to afford insurance. Families, middle-class, hard-working families are not going to see their premiums again. This year, just this week, Care First has requested a 58.8% increase on their most popular plan.
So the question about that is whether it is a failure of Obamacare or, as some would argue, it's a failure of the current administration to support Obamacare.
Obamacare was failing way before Mr. Trump raised his hand and put his other hand on the Bible. The fact of the matter is, in Maryland, the premiums went up 25% last year. So this year, the premiums go up even more. This has nothing to do with President Trump. This has to do with a failed health care policy. Look, Obamacare was, the cause was valiant, but it was a failed experiment. The premiums are just skyrocketing out of control, and there's really no way to rein them in without doing what the House did, set up these high-risk plans just like we had in Maryland before Obamacare. This will bring premiums down for the average person while taking care of those people who have chronic diseases.
Let's take some phone calls for the congressman, and I'll point out that we have a little bit of a transmission delay, so I'll ask our callers to just ask a question succinctly. We'll begin in Baltimore County. This is Bernie. Bernie, thank you for the call. Go ahead.
Hi, I want to understand how Andy Harris thinks that the premiums will be reduced for high-risk people when a high-risk person is deemed someone with acne or other conditions such as that.
Thank you. Congressman?
That's very simple. If you have insurance now, there is no increased premium. We have guaranteed issue as part of our plan. The only thing that can happen is if you chose not to have insurance and waited until you were ill to buy insurance, you probably, again, in Maryland, we're not going to ask for the waiver. So in Maryland, it's not going to be true. Everyone will be covered no matter what your condition is at the same premium. But we will subsidize people in the higher risk pool just like we did before the Affordable Care Act, so that the average premiums will be much, much lower.
Could you explain that in a little more detail? The idea that people with pre-existing conditions will be treated differently under this bill. What's going to happen?
Jeff, the term pre-existing conditions in this case only refers to people who chose not to have insurance and then chose to buy insurance when they needed it. If you have insurance, no matter what your medical condition is, you're going to be insured. You're going to be it's called guaranteed issue. You're going to be able to renew your policy at the average rate, the normal rate everybody pays. If you hadn't bought insurance, if for some reason you put off buying insurance, you just didn't think you needed it, you waited until you were sick, then you're going to pay a premium. But remember, the Upton Amendment added $8 billion to buy that extra down, so that you're probably going to pay about maybe 30% more, maybe 40% more, only for the first year. And honestly, Jeff, that's probably fair because you haven't been buying insurance up until then. You waited until you needed it. So, why shouldn't you pay a slightly higher cost than someone who's been doing the right thing and buying insurance all along? That's the only thing where the pre-existing conditions apply. And again, in Maryland, we're not going to ask for the waiver in Maryland, so it's not going to apply to anyone in Maryland.
Phone lines are all full. Let me remind our viewers, if you want to send us a question by Twitter, the Twitter address is @MPT News. Let's take a call from the Eastern Shore. Dorchester County, this is Marianne. Marianne, thank you for the call. Go ahead.
Yes, I was wondering how the congressman would make sure that people who are getting insurance for the first time, say young people who are leaving their parents' insurance policy and purchasing their own, how pre-existing conditions would be handled for them. Or if someone were, interested in taking a new policy, when that opportunity arose, how would their pre-existing conditions be protected?
Excellent questions. Thank you very much.
Yeah. Marianne, it will make no difference because the person who is on their parents' policies up to age 26 is insured. So whether or not they have a medical condition makes no difference. They're going to get a regular policy at the regular rate as long as you have continuous coverage. So, and if you want to change insurance companies, it makes no difference either because of the guaranteed issue. The new insurance company has to issue that policy at the regular rate. The only people who have a small penalty are the people who chose not to have any insurance at all and waited until they needed the insurance. It would be like not having car insurance until you had the accident and then went to buy car insurance. I think you'd expect to pay a little bit more if you could even get the policy, but you will be able to get the policy because for your health, because our bill guarantees that if you have a pre-existing condition, and even if you chose not to buy insurance up until that point, you're still guaranteed to get that policy issued. It may cost a little bit more, but again, we put $8 billion into the bill to make sure that it would cost only a little bit more and only for 1 year.
So, Congressman, whatever the merits of the Affordable Care Act, it wound up costing Democrats a lot of elections. If the Republicans do get this through the Senate, signed by the president, by taking ownership, essentially, of the whole health care system, will your party suffer the same fate?
Look, we're not afraid to take ownership of a system that brings down premium costs. I mean, that's what Americans want. Americans don't want to be told they have to buy insurance. They don't want to be told the exact kind of insurance they have to buy, and they certainly don't want premiums going up 58.8% like Marylanders will have to pay under Obamacare next year for the most popular Care First product. We'll be glad to take ownership of those things.
Queen Anne's County, this is Cheryl. Cheryl, thank you for the call. Go ahead.
Hi, yes. I was wondering if you could tell me how many of your constituents in District 1 are covered under the expanded Medicaid provision that will be deleted from the new health care bill? Thank you.
Thank you. Congressman?
Well, that's just not true. No one who is on the expanded Medicaid program will be dropped from that Medicaid program. You just have to go to House.gov, read the bill, read the amendments. People who are on the expanded Medicaid program right now will continue to be covered. No new people will be able to come in, but everyone who has coverage now will be covered.
So that was really maybe the biggest single thing in the Affordable Care Act was the combination of tax increases that largely affected upper income payers and this expansion of Medicaid. And that seems to be the biggest thing that this bill undoes in terms of cutting taxes largely for wealthy individuals and undoing this expansion of Medicaid. Let me ask you to talk about that, but also from the standpoint of what, with your experience in Annapolis, Maryland government would be likely to do about changes in Medicaid.
Well, look, I think in Maryland, we've been pretty aggressive at covering Medicaid populations. We can still ask for a waiver, and we can do a Medicaid expansion. Now, it won't be at the 90% federal match, which was true of this Medicaid expansion. But then again, we're running a $522 billion deficit. That Medicaid expansion cost $150 billion a year that we simply don't have. Now, remember, Jeff, Medicaid has a 16% fraud rate. So by turning this back over to the states, by pushing more of the Medicaid oversight to the states and making them ask for waivers, or really suggesting that they ask for waivers to see how Medicaid can more efficiently be run in their states, I think that Maryland has a shot at having a much better, much more efficient Medicaid program. We actually expanded Medicaid and the funding of Medicaid for seniors, people with disabilities, children, and pregnant women. So again, the Medicaid expansion, if states want to continue it, want to enroll new people in a Medicaid expansion, they're just going to have to pay a higher percent of the cost. And I think Maryland will choose to do it. Again, Maryland has a balanced budget. The federal government is $522 billion deficit this year, projected to increase next year if we don't get Obamacare under control.
Here's a Twitter question asking why you disagree with the CBO analysis indicating that 14 million will lose coverage in the U.S. Have they scored the new bill, or is that from the previous version?
That's from the previous version, Jeff. And of course, once we put in the high-risk pooling mechanisms that bring premiums down, we think that when you bring premiums down, more healthy young people are going to actually buy insurance, which is the opposite trend that you see now. And remember, they don't lose insurance. Probably 10 million of those, maybe more, are people who are going to choose not to buy insurance because we remove the mandate. We say that the federal government shouldn't be telling you have to buy insurance. Now, Jeff, if a state wants to mandate coverage, like Massachusetts did, then that's fine. But the federal government shouldn't be doing it because this is costing us $250 billion a year. Half our federal deficit is now due to Obamacare. We just can't afford that. So we hope that by moving more of this to the states can more efficiently deliver Medicaid. They can cut that 16% fraud rate with Medicaid. By creating a high-risk pool, they can bring premiums down, bring more young, healthy people into purchasing insurance, which brings the cost down for everyone.
Phone call from Montgomery County. This is John. John, thanks for the call. Go ahead.
Yes, my question is, why doesn't Congress fall under this Republican plan, and instead of having their Cadillac plan, couldn't Congress legislate themselves to fall under this and save the government some money?
John, thank you.
We do fall under the plan. So as you know, we're required, if we're going to accept federal health care, we're required to buy it on the D.C. small business Obamacare exchange. And because we passed a bill parallel to this bill, for technical reasons, Congress had to be exempt from the waiver provision, but we added a sidecar bill, a bill at the same time that said, no, we are actually subject to it. Again, it was because of arcane rules in the Senate. We absolutely are subject to Obamacare and all the rules of Obamacare. And again, our staffs and the Congress and our staffs have to be in Obamacare exchanges if we are going to accept federal subsidies for health insurance, as federal employees do on their regular health insurance plan.
Let's get one more phone call. Anne Arundel County, this is David. David, thank you for the call. Go ahead.
Yeah, I have some question. I understand that older Americans are going to be the odd man out here as far as, I'm not talking about Medicaid, but let's say you're going to retire a little bit early before 65. You work for 30, 40 years, and you need to get health care to carry you to Medicare. It's like a two-part question. What's going to happen with the older Americans who want to retire early, and what effects will it have on Medicare?
David, thank you very much. Congressman?
Sure. Great point. Medicare, there's no effect on Medicare. This bill really only affects Medicaid. With regards to the 60-year-olds, I'm 60, Jeff. The bottom line is that with that 58.8% Care First rate increase request, the cost of that insurance policy under Obamacare was going to go from $1,000 a month to $1,600 a month. By putting high-risk pooling in place and increasing tax credits. See, the 60-year-old who is a middle-class 60-year-old who was going to retire did not get subsidies on the Obamacare exchange. They were going to have to pay $1,600 a month. We think that not only are they're not going to have to pay $1,600, they're not even going to have to pay $1,000. With the high-risk pooling mechanisms in place, those premiums will go down, and they get a $4,000 tax credit for the first time. Every 60-year-old gets a $4,000 tax credit to level the playing field between people who buy insurance individually and people who get insurance through their employers. So most 60-year-olds, middle-class 60-year-olds, are going to find that their health care insurance is cheaper, and they get a tax credit from the government for it.
Congressman, you've given a forceful defense explanation of this bill. Is there anything you hope gets changed by the Senate?
Look, what I hope is I hope that they might in fact put in a maximum amount, that the maximum surcharge for someone with pre-existing condition. Like I say, it's calculated to be somewhere. It's going to be somewhere between 30 and 50%. I wouldn't mind if they said, look, let's cap it at 30%. So if you chose not to buy insurance until you were sick, that you'll have to pay 30% more for 1 year. I think that's probably reasonable. Again, your viewers should just know that if they have cancer, or if they have a child who has leukemia, or they have a child who has a birth defect, they're going to be covered. As long as you maintain insurance continuously, you will not have any problem. You can even change insurers, and you still get insurance at the normal rate. It's only if you choose not to have insurance that you probably have to pay a small premium for 1 year.
Congressman Andy Harris, Maryland's 1st District, joining us from Baltimore County. Sir, thank you very much. And coming up tonight, our medical segment and more of your calls. We'll be right back.
Got an unused vehicle going nowhere? Donate it to the one place that can take you any place. Visit mpt.org/vehicles and support the programs you love on MPT.
The MPT app puts our programs right at your fingertips, so you can choose when to watch, what to watch, wherever you want to watch it. Download it now.
What happens in Japan and Asia matters to me. And with NHK World's newsroom in Tokyo, I get the news live from Japan right at the start of my day.
New ideas come out of Asia all the time. NHK Newsline reports on business, technology, and world events from Tokyo to Bangkok.
Once in the morning gives me a heads up on the competition.
Every hour on the hour, the news I want from Asia.
Watch NHK World now on Comcast Channel 268 and Verizon Channel 480.
Are you turning 70 and a half this year? If so, you generally have to start spending down your retirement account. Even the minimum distribution can place you in a sticky situation. Luckily, you can now use your IRA to make tax-free gifts. Gifts up to $100,000 will never count as income, but always make a difference. That's icing on the cake.
Make your gift for this year before December 31st. Visit mpt.org/support.
Joining us for this week's Your Health segment is Dr. Pablo Argelis, Assistant Professor at the University of Maryland School of Medicine and Chair of OBGYN at the University of Maryland's Baltimore-Washington Medical Center. Doctor, thank you for being with us.
Thank you for having me.
We are coming up on something called Women's Checkup Day. Why is it a good idea for women to get a checkup?
Well, I think for women and men, it's really important to get an annual health checkup. But women, sometimes they run the household, they have a job. Sometimes they need to really take time out for themselves.
It's interesting that men have this reputation of never wanting to go to the doctor unless we're bleeding or something. And women live longer, right? So maybe there's a connection there.
There might be. It turns out, though, the gap between men and women is narrowing a little bit in terms of how much or how long we live. And some of the theories there are that women may not be taking as good a care of themselves as they used to in terms of risk of heart disease, alcohol and drug use as well. So women, unfortunately, are catching up a little bit.
Do recommendations for preventative care, the need for preventative care, change depending on somebody's age?
Jeff, that is a great question. We see patients as early as 13 to 15 years, sometimes a little earlier if they're referred by their pediatrician for menstrual irregularities. And then we deal with the reproductive years. And then we deal with a large part of my volume is menopause and perimenopause. And then really, 65 and above, these women really need good access to health care, and their needs change. So we have a real continuum of patients right from the beginning of their menstrual cycle well through menopause.
Let's talk about the non-female parts first, the things that really everybody should be thinking about in terms of blood pressure and cholesterol and diabetes screenings.
Sure. I like to keep it simple. A lot of the times I may be a patient's only healthcare provider, so I'll constantly refer to what the most current guidelines are on a lot of these screening tests. But a lot of what I deal with really is helping patients take care of themselves. So whether they're male or female, well, actually for us it's female, it's really about prioritizing their time and what checkups make sense.
That's interesting. So you are, for many people, the annual checkup.
Annual exam, absolutely.
And so frequently you're taking care of somebody in the absence of an internal medicine provider, a primary care. They see you hopefully once a year, and that's it.
Yeah, and so for a lot of basic complaints, we can manage them fairly easily, but there are times where we absolutely refer or say, you know what, I think you really do need a primary care doc, and then that personal recommendation can really help that patient establish a connection with another primary care provider in the area.
So what's happening in terms of the recommendations for routine screenings for female-specific things, the mammogram and the pap smear?
Great question. So with the advent of HPV testing that has really come into its own,
human papillomavirus.
Yeah, since about 2012, our guidelines have really changed, and a lot of my patients are a little concerned about not necessarily having a pap smear every year. Because those guidelines have really changed, and the main reason for that is really trying to prevent the risks of overtreatment as well, which is sometimes we don't necessarily do a good job of talking about in terms of screening can sometimes lead to overtreatment. So
you were telling me before the program that you've been reading recently about incredible health disparities geographically in the United States. There's been this analysis done by county.
Right. So trying to do a little cribbing or prepping for today, came across an article that literally just came out today from JAMA, and it was talking about health disparity and life expectancy. And they took death registry data by county, and then they made a map of it. And you can find it online. And some of the healthiest counties in our United States might live up to 20 years more than some of our least healthy counties in the U.S.
20 years is a staggering number.
It's really pretty sobering that there can be that much of a difference.
So let me ask it this way. What would you recommend for those underachieving counties? What are they doing wrong? What should they start doing today?
So whether you're male or female, it really comes down to our number one killer is cardiovascular health. So moving, reducing your risk of obesity, reducing your risk of diabetes. If you're smoking, you just got to stop it. And alcohol in moderation. These are really basic things, just like our mom told us.
There you go. Let's grab a quick phone call. Prince George's County, this is Bonnie. Bonnie, thank you for the call. Go ahead.
Yeah, I have a number of concerns. I'm a nurse practitioner, and under the current health care that the House passed, there's a lot of optional health care needs that can be cut off by the state. And I'm very concerned that unless the state really raises taxes.
Bonnie, we're going to leave it right there because I think that might be off topic a little bit. But let's sum up in half a minute what you want to, the message you want to leave for women in particular about basic preventative care.
Sure. I think the most important thing is taking time out for yourself and getting that annual checkup, because we're more than just the pap smear and the mammogram.
Dr. Pablo Argalas of the Baltimore-Washington Medical Center. Doctor, thank you very much.
Thank you.
Appreciate it. Thursday at this time on Your Money and Business, keeping an international partnership growing and strong for 25 years, plus an artist with a twist. That's Thursday at 7:30, and join us Friday at 7:30 here on MPT for the State Circle and the latest on Maryland politics. For all of us at MPT, thanks for watching Direct Connection, and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.